Hello, I'm Dr. Burnett with Regents EMS. Here we'll be reviewing Guideline 10, our adult pain control guideline, which focuses on the pharmacologic treatment of pain in adult patients. Pain should be assessed via an objective pain scale, such as on a 1 to 10 scale. Remember that pain can be treated very effectively without using medications. Splinting fractures, bandaging burns, and application of ice will improve your ability to control your patient's pain. For BLS providers, treating a patient with minor pain, consider the use of oral aspirin in patients who are not allergic and who are not on blood thinners such as Coumadin or warfarin. There are many new anticoagulants being prescribed, such as Pradaxa, so ensuring that the patient is not on any blood thinners is important, as aspirin and blood thinners are not a good mix. For patients in moderate to severe pain, aspirin should not be administered, as it is unlikely to be effective. One of the major changes to the current pain control guideline is to employ a loading dose followed by titration doses. We would like to minimize polypharmacy, or the mixing of different narcotics. Pick one narcotic and stick with that medication. Increase the dose as necessary. Second, we would like to encourage titration of medication. It is much better to give several small doses of narcotic than to give one large dose. Over time, providers utilizing the one large dose strategy are much more likely to overshoot and end up with hypotension or respiratory depression. You will see that the titration doses are approximately 1/2 of the loading dose. The maximum dose via standing order for fentanyl is 150 micrograms and for morphine is 12 milligrams. If the maximum dose of narcotic has been reached and the patient requires additional analgesia, low-dose ketamine would be the next step. You should not administer ketamine for pain control prior to opioids, as it is important to activate opioid receptors via a narcotic prior to activating NMDA receptors via ketamine. The dose of ketamine is in the 15 milligram to 25 milligram range. This is less than 1 milliliter, a very small amount to draw up. We have removed Versed from the pain control guideline as it does not have pain control properties, while ketamine does. Guideline 40 is our pediatric pain control guideline. This is very similar to the adult guideline, but does not include BLS aspirin due to a condition called Ray's syndrome, which may be seen in the pediatric age group. Medications are also dosed in milligrams per kilogram for pediatric patients due to the variability in pediatric weights.